What happens when your body's own defense system, the very thing that's supposed to protect you, declares war on itself? It's a really tough situation that millions of people face with autoimmune diseases. Today, we're going to take a deep dive into a revolutionary weapon in that fight, an engineered antibody called Infliximab.
So, to really get a grip on this, here's our game plan. We'll start with the problem, this civil war happening inside the body. Then we'll get into the incredible science of how this sponge drug was engineered. We'll break down exactly how it puts the brakes on inflammation, who it helps, what it's actually like to get the treatment, and finally, we'll talk about the crucial balance between its amazing power and its serious risks.
All right, first up, the body's civil war. Before we can really appreciate the solution, we have to understand the problem. With autoimmune diseases, the immune system just gets its wires crossed. It starts seeing friendly, healthy cells as the enemy and launches this constant damaging attack, which leads to chronic inflammation. And if we're looking for a lead villain in this story, here it is. It's a tiny little protein called tumor necrosis factor alpha, or TNF alpha for short. Now, normally, TNF alpha is a good guy. It helps us fight off infections. But in these diseases, the body just makes way too much of it. It becomes this blaring, nonstop fire alarm, telling the immune system to just attack. So the big question is, how do you shut off that alarm? Well, that brings us to our next section, engineering the sponge drug. You can't fight a complex biological problem with a simple little pill. No, you need a seriously sophisticated biological tool, and this is where the science gets really cool.
Just look at this comparison for a second. You've got your traditional drugs, like aspirin. They're small, simple chemicals made in a lab. But Infliximab, it's in a whole different league. It's what we call a biologic. It's a huge, complex protein, an antibody, actually, that has to be grown inside living cells. This isn't just chemistry. This is advanced bioengineering.
And it gets even more fascinating. Infliximab is what's known as a chimeric antibody. That name comes from the chimera in Greek mythology, the creature made from parts of different animals. It's the perfect name because this antibody is literally built using the genetic material from two different species.
So here's the recipe. It's about 75% human protein and 25% mouse protein. That 25% from the mouse, that's the highly specialized, super important part of the molecule, the bit that's been engineered to perfectly recognize and grab on to TNF alpha. The other 75%, the human part, is basically a disguise. It helps the drug move through our bodies without our own immune system seeing it as a threat and destroying it. So we've got this amazing part mouse, part human molecule. But how does it actually do its job? Let's get into it in section 3, where we'll look at the sponge mechanism.
Honestly, the best way to think about how Infliximab works is to picture it as a sponge, but not just any sponge. This is a highly specific, high-tech sponge designed for one job and one job only, to find and soak up all that extra TNF alpha that's causing all the trouble.
Let's walk through how this sponge action happens. So step 1, you've got way too much TNF alpha sending out those signals for inflammation. Then step 2, Infliximab is introduced into the bloodstream. It immediately starts hunting down those TNF alpha molecules, binds to them, and completely neutralizes them. They're basically taken out of the game. And just like that, the signal is blocked. The fire alarm is finally silenced.
Okay, so now that we know the mechanism, let's look at where this powerful tool is actually used. Who does it help?
This drug has been an absolute game changer for a whole list of really tough conditions. For people with rheumatoid arthritis, it can actually help stop the destruction of their joints. For those with inflammatory bowel diseases like Crohn's or ulcerative colitis, it can lead to a remission that changes their entire life. And it's also a major treatment for severe arthritis of the spine and skin conditions like plaque psoriasis.
Now, getting this drug isn't as simple as just swallowing a pill. Because it's such a large, complex protein, it has to be delivered in a very specific way. Yeah, if you tried to take it like a pill, your stomach acid would just digest it like it was a tiny piece of steak. It wouldn't work at all. So it has to be delivered directly into the bloodstream using an IV infusion. This is always done in a clinical setting like a hospital or infusion center, and it usually takes about 2 hours while you're being monitored by medical staff. The dosing schedule is also really structured. You start with what's called an induction phase. That's 3 initial doses, pretty close together, at week 0, week 2, and week 6, to quickly get the drug levels up in your body.
After that, you move into a maintenance phase, which is typically one infusion every 8 weeks to keep that inflammation under control.
Okay, we've talked about the incredible power of this drug, but that kind of power always comes with a flip side, a really serious trade-off that has to be managed very carefully.
And this really gets to the core of it. Remember, TNF-alpha, the molecule we're targeting, well, it's not a pure villain. It actually plays a super important role in protecting us from real threats, like bacteria and viruses. So, when we use Infliximab to block it, we are intentionally dampening a key part of our own immune system.
And that suppression has real consequences. The biggest risk by far is an increased chance of getting serious infections. There's a particular concern about reactivating a dormant tuberculosis or TB infection, which can be very dangerous. Beyond that, there are risks of reactions during the infusion itself, a slight increase in the risk for certain cancers like lymphoma, and it can cause problems for people who already have heart failure.
Because that TB risk is so serious, this step is absolutely non-negotiable. Before a single drop of Infliximab is given, every single patient must be screened for TB. It is a critical safety check to make sure a hidden, dormant infection doesn't suddenly become active and life-threatening.
There's a quote from the research that just sums this up perfectly. It calls Infliximab a groundbreaking but potent therapy, and says its use is always a careful balance between achieving significant clinical benefits and vigilantly managing the associated risks. It's all about weighing those two sides.
So, if there's one thing to take away from all this, it's this right here. Infliximab is not a cure. It doesn't fix the underlying glitch in the immune system. Think of it instead as a powerful brake. It stops that runaway train of inflammation in its tracks, and in doing so, it gives millions of people their quality of life back.
And that leaves us with a pretty cool question to think about, right? We've managed to create a tool that can target a single, tiny molecule with laser precision. It really makes you wonder, as our technology gets even more sophisticated, what's the next great leap going to be? What's the next frontier in solving this massive, complex puzzle of autoimmune disease?